Welcome to my presentation about a case study of a patient with schizophrenia spectrum disorder. Schizophrenia is a complex brain disorder that affects a person's thinking, language, emotions, social behavior, and ability to perceive reality accurately. Schizophrenia spectrum and other psychotic disorders are characterized by psychosis, which refers to altered cognition, altered perception, and/or an impaired ability to determine which is or is not real, also known as reality testing. Schizophrenia is a complicated disorder with overlapping etiologies. The brain of a normal person is different from a person's brain with schizophrenia, in which would emphasize the brain's chemistry, structure, and activity. Factors that contribute to schizophrenia can be summarized to biological factors and psychological, social, and environmental factors. According to the diathesis stress model of schizophrenia occurs when multiple inherited gene abnormalities, combined with non-genetic factors like viral infections, birth injuries, prenatal malnutrition, alters the structures of the brain, injuring the brain directly and affecting the brain's neurotransmitter systems, or doing all three. Here is an illustration of the brain with its parts. The three main parts are the cerebrum, brainstem, and the cerebellum. The cerebrum, which is situated on top of the brainstem, is responsible for mental activities, conscious sense of being, including our own conscious perception of the external world and our own body, emotional status, memory, and control of skeletal muscles. The cerebrum is made up of the cerebral cortex and basal ganglia, which consist of both the surface and deep areas of gray matter. The cerebrum has 4 lobes: the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. In relation to the mental functions, the frontal lobe is responsible for thought processes. The temporal lobe is responsible for language comprehension and connects with the limbic system. Next is the parietal lobe, which is responsible for reception and identification of sensory information. And lastly, the occipital lobe that interprets visual images and keeps visual memories. Next is the cerebellum, located posteriorly to the brainstem, is involved primarily in regulation of movement of the skeletal muscles as well as the equilibrium. Next is the brainstem, which has the midbrain, the pons, and the medulla oblongata. The brainstem is responsible for vital functions like the regulation of internal organs, blood gases, and blood pressure. Collectively known as the limbic system, which is on the right side of the screen, is composed of the hypothalamus, amygdala, and hippocampus. They play a crucial role in emotional status and psychological functions. In modulating the emotional value of a sensory material, it is the mesolimbic and mesocortical pathways who are responsible. These pathways uses neurotransmitters like norepinephrine, serotonin, and dopamine. And these pathways play a role in the normal and abnormal mental activity. Using imaging techniques like MRI and PET, researchers like Dean and his company were able to demonstrates structural brain abnormalities, including reduced volume in the right anterior insula, reduced volume and changes in the hippocampus, gray matter deficits, decline in cortical thickness, reduced connectivity among brain region, and white matter abnormalities. It is said, or according to theories, that neurotransmitters affects the brain or the psychosis, which can be illustrated due to presynaptic dopamine dysfunction, reduction in frontal glutamate, and increase in glutamine. Let us consider this case study of Miss Joanne Ward, who is a 50-year-old woman, unemployed. She lives with her partner in an apartment in a small town called Love. She was born and raised in Canada with her 2 brothers from a Canadian father and an Irish mother. Her parents divorced when she and her brothers were young. Then they lived with their mother and had a difficult life. In high school, she did not have many friends and preferred to be by herself. She did not go to university and got married at 20. Her ex-husband, who worked away from home, and they did not have children. When they got divorced, she stayed with her mother, who passed away a year later. That's when she started hearing voices. Her brothers, who lived close, noticed that she had not been out much. When they came in to visit her, they noticed her behavior change. She was aloof, seems to be talking to their mother, and would not answer their questions. Their mother's house looked disorganized. She looked unkempt, and she had lost weight. Then she was brought to the hospital for evaluation, where she was diagnosed with schizophrenia. Eventually, she was discharged into the community with the support from the healthcare team, the community resources, and her brothers. She has been living alone for 10 years until she met her partner, who is her #1 support now, financially and emotionally. Last November, she received news that her biological father passed on. Then last month, her older brother passed away. A day after her brother's funeral, she noticed that the voices were getting louder, more frequent, and telling her to hurt herself. She voluntarily came to the emergency department because the voices are causing her distress and making her feel more anxious. During interview, she was unkempt, rarely made eye contact, and had a blunt affect. Let's proceed to the nursing process. Firstly, with the assessment, here are examples of questions that we can ask the patients. First, what are the voices telling you to do? This is an example giving broad openings, which clarifies that the lead is to be taken by the patient. Suicidal or homicidal themes or commands necessitate appropriate safety measures. The next question is, you said you lost your brother and father recently. Tell me how you feel about losing them. This is an example of encouraging description of the patient's perception, which increases the nurse's understanding of the patient's perceptions. Talking about feelings and difficulties can lessen the need to act them out inappropriately. The first diagnosis is risk for self-directed violence related to alteration in neurologic functions, as evidenced by auditory command hallucination of self-harm. Our goal here is that by 4 weeks, Joanne will verbalize that the command voices have lessened and she has identified a coping strategy that has been effective for her during hospitalization. Our nursing intervention is to promote patient safety through one-to-one supervision and encourage the patient to verbalize her feelings and intentions about harming herself. Evaluation: Joanne states that she is hearing the voices less often and verbalized that she has learned to cope with her brother's death. And for our outcome identification, Joanne consistently refrains from acting on the commands of her auditory hallucination. Nursing diagnosis is non-adherence or non-compliance to medication related to medication side effects and drug costs. Our goal is that by the end of 2 weeks, Joanne will describe the importance of taking her medication and will not miss a single dose. For our nursing intervention, we should educate Joanne about the effects of the medication, their usual time of onset, and interventions that can relieve the effects, and refer Joanne to the medical social worker to assist her with the medication costs. For evaluation, Joanne was able to report 2 reasons why she should take the medication and what to do when she has adverse effects. And lastly, for our outcome identification, Joanne consistently adheres to the medication regimen and had not missed a single dose. Next is our pharmacological intervention. The medication's name is aripiprazole Abilify, which is a typical antipsychotic. Its action is as a serotonin dopamine activity modulator, and the side effects that we have to watch out for are neuroleptic malignant syndrome, extrapyramidal side effects, orthostatic hypotension, and sedation. And our patient teaching for aripiprazole are: first, advise patient to take medication as directed and not to skip doses or double up on missed doses. Next is inform patient of the possibility of extrapyramidal symptoms like akathisia, acute dystonia, pseudoparkinsonism, and tardive dyskinesia. When this happens, instruct the patient to report the symptoms immediately. Next is teach the patient that orthostatic hypotension may occur and to rise from sitting or lying position gradually and avoid hot tubs and hot showers. And lastly, report suicidal thoughts, behaviors, and dementia immediately. Joanne can connect or contact this community support resources to enumerate the addiction services, outpatient mental health services, and the medical social worker, as well as Schizophrenia Society of Saskatchewan. And during crisis, she can contact the Nipawin Hospital Emergency Department immediately, as well as the professional health advice by calling 811, and lastly, our RCMP. Thank you for watching my presentation.